Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So we are currently working with a client who has their mother in intensive care, and she's been in intensive care for about 3 weeks now. She's ventilated with a tracheostomy, and our client is asking, how important is it for my mother to get mobilized while she's on a ventilator with a tracheostomy? And what we're finding over and over again, most families in intensive care, they don't know that mobilization for someone on a ventilator with a tracheostomy is even possible. Now, let me dispel that myth today for once and for all. Mobilization for a patient in ICU with a ventilator and a tracheostomy should be the goal from day one. Even mobilizing a patient on a ventilator with a breathing tube, I have worked in some intensive care units where they've done that with much success and where this is possible. I've actually recorded a podcast with Dayton a while ago, and she talks about that they have done this over and over again in one of the units that she worked in. So go and look up the podcast that I did with Dayton a while ago. Now, here is what's important. Imagine someone is going into ICU with a breathing tube, ventilated, and they're put in an induced coma, and they're ventilated for about, let's just say a week or 2 weeks. Their muscles are deconditioning very, very quickly, including their breathing muscles, which is one of the main reasons why patients are having difficulties of weaning off the ventilator, simply because they are weak. Right? Picture this, you're lying in bed for 2 weeks and you're doing nothing. Of course you will get weak. Of course your muscles will decondition. So therefore, when you then wake up patients to come out of the induced coma, their breathing muscles are weak, their arms, their legs are weak. They have to learn to move again, to use their muscles. And once again, that includes the breathing muscles. So therefore, the sooner you can get someone out of bed, sit them up in a chair, the earlier their muscles recover. They are going to be used again, and they're using their breathing muscles. I have not seen anyone coming off the ventilator really in over 20 years of having worked in intensive care in 3 different countries, where I also worked as a nurse unit manager for over 5 years. I haven't really seen anyone being weaned off the ventilator without mobilization as early as possible, right? So once you start sitting up a patient, their upper body muscles get stronger, and therefore it's much easier to wean them off the ventilator, right? Imagine you're wanting to run a marathon and you need to train for it. You can't just run a marathon without training for it. It's the same with weaning off the ventilator. You can't be weaned off the ventilator after many days, sometimes many weeks or even months of mechanical ventilation without training for it, i.e. mobilization, physical therapy, breathing exercises, coughing exercises, a lot of encouragement and ongoing TLC really for those patients to make that happen. So don't let anyone dissuade you that patients in ICU can't be mobilized either with a breathing tube or with a tracheostomy. A lot of ICUs have become very complacent in this day and age, and they say, oh, they can't do it, it's too much work. They do this in other places. No, you need to do it now, so patients can get better, and they can get better quickly. It increases survival rates, it improves outcomes. Don't let anyone tell you otherwise, that they can't mobilize your loved one. It takes work, don't get me wrong. It's actually taking a lot of work, but it's definitely doable. And it's usually for all the good outcomes, or only for good outcomes that you can see in real time. Don't mobilize a patient and the mortality rates are so much higher and patients get depressed. You gotta get moving as early as possible. The only thing that stops a patient from moving or from mobilizing is if they're having fractures, for example, God forbid, or they're waiting for surgery. If they're hemodynamically stable, if they're not bleeding, if they're not having fractures, nothing should stop them from being mobilized. So that is my quick tip for today. Now, if you have a loved one in intensive care and you need help, we actually have a membership for families of critically ill patients in intensive care at intensivecarehotline.com. And you can get access if you do go to intensivecarehotline.com and you click on the membership link, or you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related, helping you steering this difficult territory that is intensive care, making sure you can ask the right questions, making sure you don't embark on a lonely road when you have a loved one in intensive care, because it is a very lonely road, you know, and we are here to help you. We answer all questions intensive care related. We don't judge you. We just want to help you to get your loved one better so that you can make informed decisions, have peace of mind, control, power, and influence. I also offer one-on-one consulting and advocacy over the phone, via Skype, via WhatsApp, via Zoom, whichever medium works best for you. And once again, I help you to make informed decisions, get peace of mind, control, power, and influence. I talk to doctors and nurses directly. I ask all the questions you haven't even considered asking, but you must ask, so that once again, you make informed decisions, have peace of mind, control, power, and influence. I also represent you in family meetings with intensive care teams, so that you have advocacy and clinical representation, and once again, that you don't talk yourself into trouble, and that you have a clinician on your team that can challenge the intensive care team wherever necessary, and that can ask the right questions. Once again, I know what questions to ask, I know what to look for, and I know your rights, and I know how to manage doctors and nurses in intensive care, and that'll make all the difference. Now, we also offer medical record reviews in real time, so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. Now, for any of that, go to intensivecarehotline.com, call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. If you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. Share the video with your friends and families. Thanks for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.